Hello, everyone, and welcome to this audio podcast. Excuse me, this audio podcast is part of a Biome edition. This audio podcast is part of a Phantom Newscast. This audio podcast is part of a Lobostics Vortex. This audio podcast as part of a Storm Lobostics production. In this audio podcast today, as part of this Biome edition, looking at research poster presentation works from 2021 and works that was put forward as a second research poster for the American Society of Nephrology. For the American Society of Nephrology, remit within for 2021. And this research poster presentation looks at sort of the quantitative perspective, looking at integrating healthcare education for best practice, and where this works is collaborative. Is collaborative between three different academic institutions, two social media platforms, and a collaborator from the United States, who was part of a government organization, and then transitioned into works with and part of a particular part of industry, a particular industry in amongst the United States. So in this works then, a little bit in regard to the aims and objectives. So, using quantitative data collection methodology, the aims and objectives of this research poster presentation, as part of this research poster presentation, was number one, to understand which topics and subjects are most pertinent to healthcare service users in context of renal recipients. Number two, to understand whether retrospectively there have been a neglect on the education part of healthcare delivery in the physical realm, amongst the physical realm, and if tech can help join up the pieces. Three, to understand on which topics healthcare service users would find further helpful. Number four, to understand what education should be made available sort of more globally, and five, to understand how healthcare and education for healthcare service users could be more integrated, so they feel more empowered. So they feel so again sorry to say so they feel more empowered. So, research surrounding the need for information and education support for healthcare service users with CKD through social media platforms or peer support groups is and has been somewhat sort of false has been somewhat false positive. This UK investigation, this UK investigation, or as part of this research poster presentation, sought to provide an understanding surrounding health information gaps, and puts forward that healthcare service users with CKD, can and tend to require sort of better understanding in regard to their health, in regard to health. So, in regard to the background, so there is or has been a push for using tech to help bridge knowledge gaps in healthcare, and amongst education. There's works by works by an author in 2017, around 2017, and where uh, where uh, where this had been highlighted. But further research still needs to investigate guidance in around areas of peer support and in amongst healthcare service user education. In this context, there is also a requirement to evaluate for example, patient and public involvement, or PPI guidelines, and focus on where commissioning, for example, is wanting. Um, a few focuses could surround, for example, e-health and e-learning modules, where healthcare service users and healthcare professionals, healthcare service users, healthcare service providers, or healthcare professionals could co-develop initiatives. The UK government, for example, has emphasized the importance of tech in improving health outcomes and providing smarter patient-centric care. Such initiatives would be supplementary to care documents that already exist as part of, for example, electronic patient records. So there is ever more need to improve healthcare integration for people with long-standing conditions, and this remains as one of the most important challenges facing, for example, the National Health Service, or NHS, and as a society. And with advances of point of care, for example, or point of care testing, POCT, or with POCT, improving healthcare for people with long-standing conditions must involve or should involve a shift from a reactive disease-focused, fragmented model of care towards a more proactive, holistic, and preventative, wherein healthcare service users are encouraged to play a centric role and take ownership. And so, by encouraging education and relating context across a range of health disciplines, this would also reduce inequity, increase literacy, for example, and language, and improve overall healthcare amongst long-standing conditions and long-standing condition populations. So now in regard to looking at healthcare service users and healthcare service users seeking educational support. So it has been some time since the UK government originally published a document referred to as the Expert Patient, a new approach to chronic disease management for the 21st century. And the intention was that healthcare service users would lead others through example, being experts in amongst particular conditions. Although the initiative was published in the United Kingdom, in Australia, works by an author in around 2018 had identified where expert patients in amongst, for example, chronic kidney disease and recognized areas of development related to good quality information. And there was an issue around provision of appropriate culturally and aware provision of appropriate culturally aware information, and knowing who and for healthcare service users knowing who to contact. This was especially important in remote communities with limited access to healthcare. The inclusion of expert patients or healthcare service users, is not and has not been broadly reported in amongst the literature. Another investigation in around, more retrospectively, in around as early as 2000, 2000 in amongst the mid 2000, as early as 2005, in Scandinavian females with particular condition and with particular healthcare conditions. Works had informed significant internet use as a source of information on health in and around health and illness. Investigation indicated that language can be a barrier or hindrance since a default the sort of default online language is in English. The number of medical websites written in English is greater than in other languages and can be either advantageous or disadvantageous depending on who is seeking out information and context. Healthcare service users tend to require understanding of a disease of conditions and sort of and in around processes, and depending on for example where in regard to where CKD chronic kidney disease stage and severity is concerned, the healthcare service users healthcare service users should sort to gain comprehension of treatment modalities in line with care pathways, and this includes, for example, home hemodialysis, for example, in-center dialysis and transplantation, and how treatments are how treatments are delivered, for example, for example, where dialysis access through arteriovenous fistula or arteriovenous graft, central venous catheter, or peritoneal dialysis catheter, where peritoneal dialysis is concerned or where peritoneal dialysis is required. Healthcare service users also require or tend to require sort of understanding of pharmacotherapy side effects and physical aspects of conditions and physical aspects of conditions and well-being, especially if heading towards so that adverse interactions can be avoided. And so now looking at sort of primary care networks and allied health professionals as part of this research poster presentation from 2021. So providing staff aid staff staff centered providing staff healthcare service users healthcare service providers provide healthcare service providers education centric education at the same time surrounding kidneys or kidneys, for example, is important owing to changes in health and conditions over time. Primary care staff should also sort to keep up to date with aspects that surround healthcare healthcare and where healthcare service users can be at risk and where healthcare service users can be suspect or at risk, and consult guidelines to meet best practice. And it is good practice to ensure, for example, renal function and pharmacotherapy is used and are used routinely. It is good practice to ensure renal function and pharmacotherapy use are routinely reviewed and routinely reviewed through primary care teams, and also on where allied health professionals or AHPs are concerned. More educational interventions are required to support best practices, and this could and can be achieved through collaborative working through what has been amongst the literature as primary care networks, and prompting broader allied health professionals to be involved at primary care level. Healthcare service users may additionally require require advice to help search out information to search out sort of education in regard to healthcare service provision, and to also steer clear of misinformation. Now looking at sort of the sort of this where this research poster presentation goes into some of the into the parts into parts of this into parts as going into sort of the data into aspects of the into aspects linked to the data collection around this works. So now look at so now before going into the aspects around the data collection aspect, the data collection, looking at patient and public involvement, the ethics aspects, and the material methods or the methodology. So topic tags were co-developed for this investigation, where topics between two social media platforms were co-developed having understood the aims and the remit of the social media platforms. Before topic tags were co-developed, an extensive investigation for 1 month between March and April 2020 collated the most popular terminologies. This resulted in 14 different topic tags being co-developed. Topics were tagged for 2 weeks per social media platform. RPSG, the Renal Patient Support Group, representing the online adult renal population, and 2 weeks through KDARS, representing the online pediatric renal population. Topic tagging retrospectively aided the understanding of healthcare areas of healthcare and areas that were popular, and where recipients or healthcare service users between the two social media platforms would find advantage advantage from further for further involvement. Topic tagging has also been utilized in works conducted from authors in 2005, 2007, and 2021. So conducting a 16-year retrospective descriptive analysis of topics and tags between two social media platforms sought to understand where there has been inefficiencies, and identifying educational needs still, and where educational needs, for example, still need to be met between both pediatric and adult cohorts. In addition, quantitative data collection was implemented to understand online healthcare service user requirements. Software referred to as Qualtrics was used or utilized, which was utilized, where a survey link was put in place through through social through primarily the social the through no sorry through the two social media platforms and where participants only had to complete the survey once. Descriptive analysis was used to analyze data, and the data collection followed on from previous published works from 2020. As part of this works, where ethics was concerned, there was the works went through an ethics committee in the in the in the as part of the ethics committee in the northwest region of the United Kingdom, and this research had a main project project ID or project identification, and patient and public involvement or PPI had also been an important mechanism involving patients. Had focused had added focus and rigor to this works. So now looking at as part of this research poster presentation, looking at a summary of the main topics, main topics developed, main topics co-developed and tagged between the two social media platforms. So there were 14 topics that were tagged, 14 topics that were co-developed, and once topics were co-developed, the any as part of this works, the investigators look to gather the data and look to gather the data where any works within any threads or discussions that had these terminologies were tagged, and the tagged topics included the 14 topics tagged included lab tests and biomarkers, biopsy and surgery, nutrition, renal replacement therapy, psychology and related, medication and pharmacy, lifestyle, primary care, wellness and well-being, nursing, physical activity, educational and interactive, peer support, and finally COVID-19 and infections. So in this poster presentation, looking at some of the analysis, in regard to as part of sort of a descriptive as part of descriptive analysis. So quantitative data was analyzed descriptively to inform frequencies and variables of differences between. Quantitative analysis that helped identify if there is a role for example, allied health professionals to support healthcare service users in primary care, and to also establish any correlations against similar research. All quantitative data was analyzed again through using a Qualtrics software, which at the time was the academic institution's approved service for quantitative research. Equally, Qualtrics software helped quantify data numerically and helped understand whether there are any statistical significances. Qualtrics software was the only sort of online survey software validated and authorized by the academic institution. The in regard to the healthcare service users, and what will be described described as part of this poster presentation is just a summary in regard to this works. So in regard to healthcare service users, then the following questions were put forward as part of this works. So number one, describe your CKD status. Number two, perception of CKD in primary care. Number three, number three, received extended education. 4, future models of care. 5, CKD and primary care education. 5, technology and digital healthcare. 6, information communication and technology. Number 7, appropriate support surrounding healthcare access. 8, healthcare communication and support. 9, influences on taking ownership. 10, ongoing learning and care, and 11, in regard to gender. Number 12, age, and 13, ethnicity. So a summary of the analysis, a summary of the analysis, and what have been what had been highlighted in regard to the the questions, and where the questions related to the themes that had just been highlighted. Not all of the data that will be described in this summary will be in regard to all of the themes or the questions. So CKD patients that contributed the highest included transplanted recipients. Recipients just around 60.53%. Second were end-stage renal disease, where healthcare service users or recipients were on hemodialysis around 13.16%. And then patients or recipients with or healthcare service users with CKD stages 3 through 5 around 10.53%. The lowest responses included CKD who was suspect or high risk, where there was no where there was where no where there were no recipients when no recipients when no recipients when no recipients no recipients had participated or added to the data. And then in regard to CKD stage 1 through 3 around 2.63%. A total of 36 responses was established from this particular question. Overall, the overall mean was 5.34, and standard deviation was 1.26. In regard to healthcare service users with CKD who contributed relating or regarding appropriate support surrounding healthcare, highest responses included in regard to where healthcare service users or participants had the choice to select from varying choices in sort of as part of the survey. The highest response included I have ability to communicate with healthcare professionals about blood tests and investigations around 25.49%. The second highest response included healthcare professionals should be prompted for more patient for more healthcare service or patient activities around 25.53%. And then I have links excuse me. Additionally, in regard to I have links to patients with CKD for peer support and I have links to patients with CKD for peer support and are needed so that I can share experiences around 25.53%. The lowest response included the lowest response included in regard to I have ability to access supplementary education from healthcare professional who conduct laboratory investigations around 5.88%. The poster presentation itself only describes or summarizes the sort of in graphical format data surrounding gender, age, and ethnicity. And for the purposes of this audio podcast, for the purpose of this audio podcast, the graphical data in around this will not be informed. In regard to healthcare professionals, in regard to healthcare professionals, the following questions were posed. Number 1, describe your profession. Number 2, perception of primary care. 3, extended education provision. 4. Future models of care. 5. CKD and primary care education. 6. Healthcare professionals and electronic patient records. 7. Primary care and electronic patient records. 8. Information communication and technology. 9. Technology and digital healthcare. 10. Allied professional future roles. 11. Skill mix and leadership. 12. Safety and governance in primary care. 13. Screening and biomarkers. 14. Gender. 15. Age. And 16. Ethnicity. In regard to the descriptives around this, 2 of the highest response related information communication technology, or ICT, included one of the principal roles of healthcare professionals is using ICT, around 16.67%, and technical issues is a barrier to ICT, 16.67%. Second highest response relating to ICT was where healthcare professionals unwilling to use. Second highest response related to ICT was where healthcare professionals are unwilling to use or contribute to through ICT, 11.11%. Two of the highest responses related allied health professionals and future roles will increasingly work with general practitioners, for example, to provide laboratory screening and point of care testing advice and or education around 16.6%, 16.67%, and healthcare scientists and allied health professionals will deliver more NHS professional services such as educational support, understanding of disease trends, and medicines use reviews, for example, etc. 14.29%. 2 of the second highest responses included allied health professionals will provide more supplementary education and health promotion services, around 9.52%, and allied health professionals will support general practices more efficiently, streamlining practice, around 9.52%. 3 of the lowest responses included patients will have access to allied health professionals through educational podcasts or webinars, 2.238%. And patients will have access to allied health professionals through smartphone or for supplementary education and support, 2.38%, and patients will have access to allied health professionals through social media or instant messaging apps for supplementary education and support, 2.38%. In this within the research poster presentation, there is some graphical data and the data summarize surrounding gender, age, and ethnicity, and the research will not this audio podcast will not inform or in regard to the data around gender, age, and ethnicity, although to inform much like the healthcare service users and healthcare service users and healthcare professionals involved or those who have participated in this works had varying had been and were from varying gender, varying age, and varying ethnicities. So now some conclusions as part of this research poster presentation. From 2021. So close to or near 2 decades. Healthcare service users have been sharing experiences or lived experiences, understanding between the 2 social media platforms to help inform smarter care and decision making, using online support or social media platforms or groups as space wherein they otherwise have limited peer support, wherein they may otherwise have limited peer support and communication has been important. Has been important. One could debate what context as listeners may or may not know, an audio podcast as part of this edition, a previous audio podcast as part of this edition, this Biome edition. There was works that looked at the some qualitative data in regard to some similar works, and the main one of the main questions as part of the audio podcast in that research overview, and as part of this research as part of this audio podcast is and was one could debate what context and understanding is deemed as clinically relevant in context of how healthcare service users, carers, for example, share lived or experiences, share lived experiences through the two social media platforms. So healthcare service users are not trained to communicate clinically relevant context, and it could also be debated that most of the shared experience through social media platforms is all important and relevant. Healthcare service users have their own ways of sharing, understanding, interpreting, and communicating health complexities. This snapshot investigation highlights the need for healthcare professional involvement to support healthcare service users seeking out education in addition to peer support. Education could be equally delivered through online podcasts and webinars, as the NHS, as the National Health Service, as the NHS or National Health Service needs or requires and sorry as where as the NHS or National Health Service requires looking into investment in regard to, for example, online podcasts and webinars, for example. And this is was one of the first international retrospective investigations that examines educational gaps between online pediatric and adult renal cohorts, close to 2 decades, co-developing educational modules involving healthcare service users and healthcare professionals would prompt more joined up care in meeting educational needs and addressing healthcare inefficiencies. That draws this audio podcast to a close. This audio podcast as part of a Biome edition. This audio podcast as part of a Phantom Newscast. This audio podcast as part of a Lobostics Vortex. And this audio podcast as part of a Storm Lobostics production.